The heart and the cardiovascular system, which means the heart and all the vessels that go out to our body, the arteries going out bringing oxygen and nutrients to the body, the veins bringing everything back to bring to the lungs to exchange the oxygen. Again, the heart is essentially a big pump that pumps from the moment where we have our little heartbeat at 6 weeks into the pregnancy up until the time we die. The right side of the heart pumps blood into the lungs, gets the fresh oxygen, brings the fresh blood back to the left side of the heart, and then the left side of the heart brings the body around to the brain and it pumps around to the rest of the body. Again, the most obvious thing that we know goes wrong with our heart is where the vessels that supply the heart can become clogged and block, and we have a heart attack or an ischemic event, a myocardial infarction, and these all relate to the same thing, which is where one of the vessels gets blocked, and of course the area of the heart that gets supplied by that vessel gets destroyed or damaged. The most fascinating thing nowadays is these stem cells, these cells that can regenerate. They're now injecting stem cells into people's hearts where they damage muscle, and in certain cases there's regeneration of the cardiac muscle. We can get electrical problems with the heart, arrhythmias, where the rhythm of the heart becomes abnormal, atrial fibrillation, tachycardia, and those conditions sometimes require drug therapy and sometimes require a special intervention where you destroy the abnormal electrical current that's coming through the heart. Valve disease, where the valves become damaged in the pump, and that was again very common in times before, when infection would create a thing called endocarditis, which could damage the valves, but that's less common now. But we still can end up with a faulty valve again, particularly with aging, and they sometimes require surgery to actually replace the valve. The peripheral vascular system, that's the vessels that go right throughout our body. By far and away the most common problem that we see with that, of course, is hypertension. The best way to describe the cardiovascular system is like a central heating system in your house. If you imagine that central heating system is having to pump the water around your central heating system under greater pressure, well, the likelihood of a valve bursting or the boiler breaking down is much greater than if it's running on lower pressures. So high blood pressure quite often doesn't make you feel unwell, but as the years go by, the strain on the cardiovascular system can lead you to a heart attack or can lead you to a stroke, where one of the vessels in your brain gets blocked or damaged, and as a result a part of your brain dies, and then of course you get the relevant weakness depending on what part of the brain gets affected. The other conditions you can get with vascular is where the peripheral vessels become damaged. You can get varicose veins, where the muscle and the valves get damaged, and they could become swollen and bloated. And you might need a vascular surgeon to help you with your varicose veins. Or you can get ischemic vascular changes, which again, not unlike the heart, is where the vessels throughout your body can become narrowed and clogged. And as a result of that, it can lead to problems.